My name is Brian Cervenka. I am a head and neck surgical oncologist and microvascular surgeon here at University of Colorado Anschutz campus. So my story in medicine actually started with my own health challenges as a teenager. I have a type of heart condition where my heart was beating too fast and required multiple procedures as a kid. And just going through that process and learning about the condition, the physiology, really drew me into understanding and the knowledge base of medicine, how that can be very powerful and rewarding and bring a lot of comfort. And so learning that and just being a patient myself really drew me into medicine, in particular in college and then medical school. Patients come see us when they have head and neck cancer. And so that can be anything from oral cavity cancer to base of tongue, to tonsil, to voice box, to your upper part of your swallowing tube. And then because we perform complex microvascular reconstructions, and what I mean by that is we bring tissue from one part of the body to the head and neck and then hook the blood vessels up. It allows us to perform really complex reconstructions that you sometimes need even after traumatic accidents, airway reconstructions after tracheostomy tubes or other types of injuries, in a number of different situations. I start every visit really trying to understand who someone is in terms of where they came from, what they do for their life's work, do they have children, what are their goals, what do they want from treatment, because I find this allows you to make a much more personalized decision when you're treating and thinking about different treatment modalities and selecting something that will make sense for them long term. And then I also find this really serves as a foundation for a relationship that you have for at least the next 5 years as you monitor and surveil someone after treatment. And that's really an aspect of head and neck oncology that drew me to the field most, was getting to know people on a very personal level over a long period of time. What I value most is working through incredibly difficult diagnoses in times in a very stepwise and slow fashion with the patients to make it easier to understand and much more approachable. So what I mean by that is a cancer diagnosis is probably one of the most difficult that any person can receive. And I think it helps tremendously to spend the time and to break treatment down into as many small steps as you can. And so you understand what to expect at each one of the junctures and treatment steps. And we're there with you the whole time. We're there with you for the initial consultation, for the operations, as you start adjuvant treatment if you need radiation or chemotherapy. And just working through that process together I find to be incredibly rewarding.